Hello, I am Margo Pumar. I'm a psychiatrist for the Department of Psychiatry at the University of California in San Francisco. And today we're going to be talking about relationship safety during this very difficult time. At one point or another, everyone experiences stress in their relationships, even conflict. But a question you might ask yourself is whether or not you feel safe in your relationship. Below are some questions that you could ask yourself or a loved one that you're concerned about to help you explore that question further. Does my partner let me talk with others? Does my partner behave safely with children, share money, respect me, scare me, put me down, or even hurt me? And below are some links for some further information to explore this question. One is at leavesf.org and the other is at loveisrespect.org. Relationships hopefully should be about give and take and sharing, but sometimes they are about intimidation or control, or one person exerting power over another in a way that causes harm. And this is called abuse. It's also called intimate partner violence, interpersonal violence, domestic abuse, or relationship abuse. And ways that this occurs is one partner might force someone to be isolated or cause emotional abuse or verbal abuse by putting someone down. They could control money or use threats or even intimidation to try and control another person in a way that makes them not feel safe. Now, when I speak with my patients about this, and if this is going on with them, one of the most common things that they will say to me is that they feel very ashamed and they feel like maybe they're the only one. Sadly, 1 in 4 women in the US are actually victims of some type of domestic violence. In the US, 3 women are murdered by their partners every day, which is why this is a real issue of safety. And 1 in 6 women report that they have survived an attempted or completed sexual assault. So in fact, if you're wondering if you're the only one, you're actually one of millions. So we want to highlight this issue now during the COVID pandemic because we're concerned that IPV or interpersonal violence could even be worse during this time. During any crisis where there's more stress, people are losing jobs, people have less money or worry about housing and these like basic, really stressful things, IPV can increase. But during shelter in place where people are kept in together, especially in the Bay Area or other cities where there's really tight quarters, we expect that this stress that is taken out on each other can even increase. Further, children who can be in homes like this can lose school as their safe place. And it just makes things really difficult and chaotic. Here's just a little bit of information about pregnant women. But physical harm towards women will often lead to increased risk for babies. Here's just some examples. Injury to the uterus or fetus while the woman is pregnant, babies being born too early or too small, then later struggling with nursing, sleeping problems, even having delays in walking, talking, or learning, and sometimes lasting emotional problems. So if this is happening, what could you or a loved one do? Well, the first thing I recommend doing is making a safety plan. There's really great information at this link, leapsf.org, and there you can find safety plans in other languages as well. Number 1, make sure that you can try and stay safe during a fight. If you know that one's coming, try to get to another room. Always keep a little money on you. Keep your phone charged and with you. Teach children to go to a safe place as well and call the police. Keep an emergency bag packed and in a safe place. Keep in touch with a support person or a family member And I like to encourage people to memorize a hotline number. If you don't know anyone else to call, you can call 1-800-799-SAFE. And actually, if you do have other people to call, I still think it's a wonderful resource, and I strongly encourage you to connect to one of these hotline numbers if you're struggling with this. And then also, you can talk to a medical provider. I also recommend that you make a survival kit. This has more information like legal rights and other things that would be important to know about. This is a bit more detailed, and so I recommend that you go to www.dvguide.com, and there you can find links for survival kits for the rest of the US and also specifically for New York. If you live in the Bay Area, here are some specific resources for you. Women's Inc. serves women who are survivors of domestic violence, and it can be reached 24 hours a day. La Casa de las Madres is also available 24 hours a day, and their shelter remains open even during shelter in place. There's also the Cooperative Restraining Order Clinic, San Francisco's Women Against Rape, and the Community Against Violence. And finally, there are some national resources. As I already mentioned, you can call 1-800-799-SAFE to reach the National Domestic Violence Hotline. Survivors can also chat with advocates or text LOVEIS to 22522. There's also the National Sexual Assault Hotline, which is 24 hours, the Trans Lifeline, and even the Deaf Hotline. Remember, you are not alone, you are not to blame, and you do not deserve to be abused. There is help for you. And I'm going to say this hotline again. It's 1-800-799-SAFE. I thank you so much for taking this time to listen, and I hope this helps you or someone that you know stay safe during this difficult time.